Well, thank you. Thank you so much for the invitation to be here. This is very exciting. Oh, yeah, we're good.
Okay.
Yeah, we're good. So I had no idea there'd be so many people here, so I'm really nervous. So, and I know some of you people know me, so it makes me more nervous. So it's February, and how many people knew they call this American Heart Month in February? Everybody knows that. Yeah, everybody knows that. So that's an easy question starting out. So we're going to talk about heart health. So how many people know somebody who may have or does have some heart problems? So yeah, so there you go. So what I'm going to talk about, and it won't take all day, it's just a few tips that I have for people. I have 5 tips on how people can have better heart health, and you guys could probably name some of them. So when you go to your doctor or when you watch TV and things, well, what kind of things do you hear that can make your heart better or stronger?
Exercise.
Exercise is good. Okay. Okay. Diet. Okay.
Lose weight.
Lose weight. Okay.
Medicine.
Yeah.
Red wine.
Yeah.
All right.
So I did my talk, so I'm done. So thank you everybody for coming. So a lot of that is what is on my list here. So I have a list of 5 things that I tell all my patients about heart health, and it's not only, it's for all ages. It's not just for a certain age group. So the first one is staying active, and especially as you get older, it can be a little bit more difficult to stay active. It's easy just to kind of just sit in your room or sitting and watching TV. But it's important to get up, a little bit. You don't have to, run a marathon or anything like that. But staying active, not sitting so much, that's definitely going to help. And I tell my patients, even if you just take a little lap around your room, or around your home, 2 or 3 times a day. I know it's tough, when it's cold outside and it's icy to try to get outside, but there's a lot of stuff that you can do inside that you can do that, and I have a lot of my patients who have things to help them walk around. Okay, that's very important to do that. I have a lot of my patients who sometimes stumble a little bit, or it's difficult for them to walk around, but it's important to do that. You may have heard the term, use it or lose it, and you have to keep going with that. Unfortunately, I have a lot of my patients who, they get tired, they get weak, they get up and go to the bathroom in the middle of the night and they trip and fall and they break something, and certainly we don't want that to happen to any of you. So the first tip is very important, is to not only stay active, but not sit a lot. Not sit and watch television or sit and watch the fire all the time. It's good to do that a little bit. And finally, when the weather breaks, get outside a little bit. Get outside. Everybody has cabin fever this time of year. So, when the weather breaks a little bit, it's good to get out a little bit. So staying active is very important. So, yeah, the second thing, is diet. Everybody gets yelled at, for their diet. You should eat better, but it's very important, especially with heart problems. Everybody's probably heard, if you have certain heart problems that you shouldn't, have as much salt in your diet. Some people have to watch their cholesterol. Some people have to watch their sugar. And it's not like you have to get rid of all of that, but, cut back a little bit on that. Everybody can have a little bit more fruits and vegetables in your diet. just to mix that a little bit. And my patients always give me these very great recipes for me to try something that they've stumbled onto, or sometimes it's some of their family traditions that they've had. So it's easy to kind of get bored and mix, but it's good to kind of mix things up every once in a while when you're trying to eat better. It's a challenge sometimes. And I tell my patients, it's hard to avoid, that snack, at the end of the evening or before you go to bed. I mean, I know, some people with some medical problems, like sugar and things, people like to have a little bit of a snack before that. But just kind of see, check out what that is. I mean, maybe you can have, a fruit or a vegetable for snacking instead of reaching for that, processed sugar or cookies or, which we all do. It's normal. But diet is very important. Diet and exercise are very important for your heart health. So the third thing is also kind of not easy to manage. But I tell my patients, about stress. You feel stress, you have stress, the stress goes to your heart. I've had a lot of my patients, unfortunately, who, they have a tough time with stress, and sometimes it causes more heart problems. Sometimes it causes that heart attack or something like that. And, there are ways to deal with your stress. And it's not just, popping a pill. It's not saying, hey, doc, I need a pill or something like that. There's a lot of things that you can do. I mean, I've had a lot of my patients talk to me, about things like, just thinking or meditation or that type of thing to help, just kind of calm down without medication, without a pill. Exercise is good, for stress. It helps you help work out some of that stress that goes on through the day. Everybody has stress, especially maybe with other family members and things. I mean, that happens, or maybe stress with your doctor. I mean, not with my patients, but sometimes you have stress there. But dealing with stress is important. I mean, we've all known people who, they get too stressed out, or maybe it's a bad situation, a death in the family or loss of a job or something like that. It really causes them to have more stress, which raises their blood pressure or causes them to have symptoms like chest pain and things like that. Those are things you have to really kind of keep track of, with your friends and family, because, more stress in your life, or more stress that you can't control, really can really press on your heart and really cause more heart problems. So does that make sense? So we're staying active, and we're eating better, trying to eat better. We're trying to deal with more stress. So number 4 is, manage, your medical problems. I mean, sometimes people with heart problems have other medical problems. Sometimes they have sugar problems, or unfortunately, some people are dealing with cancer and all the medicines that go along with that, or they're dealing with cholesterol problems, or they have thyroid problems. One of the things that you can really manage, your heart health better is to, take your medications for your other conditions, and if anything, comes up, I mean, you talk to your doctor about it, or you let somebody know, hey, I may be having a problem with this medicine, or, something else is going on that I really need to check out what's happening with my thyroid, or with my sugar diabetes, or that type of thing. So people who don't manage all of their other medical problems, sometimes it can really cause some heart problems too. So and the last one is it's very important to listen to your body. Listen to your symptoms. If you're starting to have anything out of the ordinary, dizziness or lightheadedness, or you start to have some chest pain or problems breathing, or stomach pain, anything like that, I've had, a lot of my patients, unfortunately, ignore this and think it's something else. They think it's old age, but then it ends up being something else. And If you start to have any of those signs or symptoms, it's important to tell somebody about it right away, because it could be a sign. It could be a sign of a heart problem. It could be a sign of something else there. So basically, I mean, those are the 5 things, you know. I know a lot of people have a lot of other things on their list, and I know that, you know, a lot of you have already mentioned, you know, some of those. But, you know, staying active, trying to eat a balanced diet, you know, trying to manage your stress in a better way, you know, managing, you know, your other medical problems and things. And, you know, listen to your body, you know, when it's talking to you, especially when you start to have some of these symptoms. It's important to tell somebody or to let your doctor know what's going on, you know, with all of that.